My name is Dr. Czestochowa Francois. I'm from New York originally, and I'll be serving the Maryland area. So originally, like I said before, I'm from New York City. I did my undergrad at Yale. I did my training and residency at the University of Rochester, upstate New York. Worked as faculty at Hopkins for a year. And then I kind of found my way into CVR and vein work through the fellowship. I work as an emergency medicine physician. I have about 5 years of experience altogether in the field. And one of the things that I love about it is the breadth of patients that we get to see, which is actually something that's similar in the vein world as well. I found that there were a lot of patients in the emergency room, and a lot of patients currently still, that I couldn't address who suffered from vein disease. And it was nice to be able to do something definitive for them. I was always interested in procedures as well as ultrasound. And so this gave me the opportunity to do all of those things and to connect with patients on a more personal level. My patients have my number. They're always able to reach out to me. And so that's something I really value. I think the reputation precedes it. It was one of the biggest organizations that both trained vascular fellows as well as employed vascular fellows. I felt like I would get a quality education with CVR, and the people that I've met have been remarkable. They've all been willing to teach, they've all worked with me, and they've served as colleagues as well as educators. And the best thing about it is that you always get to learn something new from one another. And we're all striving for the same things, which is excellent patient care. And so, honestly, I feel honored that I was chosen to work with CVR. It's quite the pleasure. I feel like in today's society, with a lot of patients, it's easy to feel like you're swept up in the system, like the system doesn't care enough about you. And my philosophy when I see a patient is to make sure that when I see them, at the moment that I'm seeing them, that they understand that they have my undivided attention. That for that moment, I consider them and I provide them with the care that I would my own father, my mother, my sister. I want them to feel like they've had that impact on my life, as well as that I am trying to positively impact theirs. So that's kind of my philosophy in regards to healthcare. I try to treasure my patients. I have done a lot before coming to medicine, after going into medicine. And so I kind of bring with me, as a proceduralist, as a vein specialist, all that kind of experience. I've worked with NGOs, I've worked with many different types of groups. And so that's kind of my unique skill, I think, to see things in a little bit of a different way and to have that a little bit eclectic background. I think it makes it a lot easier for me to reach and really engage with patients from all different sorts of walks of life. And that's probably the most valuable thing that I own. I think as providers, we do a lot of treating. We tell a lot of patients that this is what you have, this is how we need to do this. But we don't teach. We don't take that opportunity to sit, face to face with them and say, what do you think about this? How do you think we should proceed with all the information that I can provide to you? This is what I have to teach you about not just your leg health, but how you approach everything in your life related to your legs. And I think at CVR, more than a lot of other places that I've worked, we have the unique opportunity to do that. And I think it's something that the company strives for. I want my patients to know that when they walk through the doors of my clinic, that they'll be heard, right? Regardless of whether or not the issues they have are strictly related to leg health or tangentially, or if they just need additional advice or help. I want them to know that that moment that I've carved out for them is a moment where they'll be heard and helped. And I think that's really important to be able to provide, and that I'll teach. right? It's hard to navigate healthcare. There are a lot of terms, and even as a physician myself and clinician myself, I find it daunting sometimes. So I think it's a really valuable experience to be able to sit across from someone and teach them about something that they can get kind of autonomy and ownership of. And so that's what I'd like them to know about me. But I'll take care of their patients. I think that's the most important thing that clinicians care about, as well as closed loop communication. So if there's anything or any information that needs to be relayed, it will be relayed to them. And we're a team. Regardless of how things turn out, I am in there with them, helping to take care of this patient. I understand the importance and the trust that lies in doing so, because I do it myself. So, and also, I'd just like to thank them for doing so. I think that it's very easy to dismiss vein health and kind of live with it. And until I learned more about it, it didn't take as much importance to me. As a person who has family members who suffer from varicose veins and has that literal weight on their legs, I think it's important to know that you don't have to continue to kind of suffer from that in silence, and that there are places where you can be heard and managed appropriately. And in a chaotic healthcare field, where that's not always the case, unfortunately, this is a truth that I found at CVR.